Do you have tight joints, stiff fingers, limited shoulder mobility? These are musculoskeletal issues that may be related to your diabetes. I'm Dr. Steve Edelman, and we are taking control of your diabetes. I founded Taking Control of Your Diabetes a long time ago to educate and motivate people with diabetes to live a longer and healthier life. Please subscribe to our YouTube channel for more educational material just like this. Trigger fingers, frozen shoulder, stiff hand syndrome, positive prayer sign. These are rheumatologic abnormalities seen in people with diabetes. Besides being an endocrinologist, I've had type 1 diabetes for almost 55 years, and I have collected some of the classic and not so classic complications. So let's just talk about trigger finger. Trigger finger is when the tendon that moves your finger up and down gets swollen from long-standing diabetes, poor control, and when you bend your finger, you all of a sudden cannot bend it back. At first it starts to click, after a while it gets frozen there. Treatments are typically injected with steroids. If that doesn't work, which usually doesn't, you go to a very good hand surgeon. It's an easy, quick surgery so you can straighten your fingers out. I've had 3 surgeries. The little scars are right here. They're not too bad scars, and I now can move my fingers freely. The other thing that relates to the hand in people with diabetes is a thing called stiff hand syndrome and the syndrome of limited joint mobility. This is the positive prayer sign. I am looking at the space between my 2 fingers there because I can't make them perfectly flat. Now, things have gotten better through the years. I've learned that you've got to do exercise like squeezing on a little ball of putty or just muscle strength. Anything in your hands and your wrists will help kind of reduce the stiffness that you get. The other issue I want to talk about today, not the last issue, is frozen shoulder. And you ready for this? Adhesive capsulitis. And that's a good word because you get adhesions in your shoulders from sort of the same reason why people get other rheumatologic abnormalities. It's glucose binds to the tendons and ligaments. They get stiff and thickened, and basically your whole shoulder gets frozen over time. So if I tried to take off the belt or something on my belt, if I was a female and I needed to take off my bra, if it opened and back, it kills. Super painful. And how do you treat that? Well, you got to go to a good physical therapist, hopefully early. And you may not notice that this is going to end up into a serious frozen condition that's very painful. You may not even think it's related to diabetes. But remember, there are rheumatologic manifestations of diabetes, and that's important. Don't let any doctor just say, it's from high blood sugar over the years. There's nothing you can do about it. A good physical therapist will work with you, get some range of motion, might be painful. In fact, if it's not painful, he's not a good physical therapist, or she's not. And you may need to have your shoulder injected with steroids, anesthetics that can help the physical therapist move your shoulder. Other people go to the operating room, they put you under anesthesia, and they just crank your arm and break up the adhesions. And that way it's painless. And that's the key, breaking up the adhesions. It can occur in people with diabetes and without. Typically occurs in women if you don't have diabetes. And I've heard, and so far it's true, you only get it 1 time per shoulder. So I've had it in my right, had it in my left, so I'm done. I hope that statement stands true. Have you ever experienced trigger fingers, frozen shoulder? Please let us know in the comments below. With that, I'm going to stop and check out the rest of the information on this on our website.